you're saying, right?
Yeah, this is what he unearthed only yesterday in conversation with Mark. Because Mark was concerned, like, how am I going to give him everything? We're all concerned about how I give him everything in 2 days, right? And this explains that you don't have to. He's saying, relax, enjoy yourself. Get them technically competent, they'll come back for more. This is up for, a little bit up for grabs right now, but it'll always underlie at some level what's there.
I'm not clear what you mean by not what. I get why, I get how, but what do you mean by what?
We'll have to ask him.
Oh, that's what he said.
That's what he
Exactly.
said.
I
Did he?
can tell you what it is.
Go ahead.
What?
Show them how to do the sit test, don't explain why it works.
And you
Don't even explain
you
why.
don't get my trust. I don't feel safe. So how are you going to work with me?
Show them how to do the synchronous test and don't even get into why it works.
I know. See, you guys are going to have to make that decision. Josie doesn't care. Just so you have to make the decision how much you say. But this is the result he's been going for, just so you know. I think because we're moving into adolescence, right, that we're upping that game and we're trying to figure out what's the best way to widen the circle and get the information out and sink it into people's bones. Because I know I need it cognitively, I need a picture, I need it in my body. Then I see the results, then I'm like, I want, you know? So again, what moved you? And you're going to just have to go from that place. But understand, this is what has moved him. Go ahead.
And be certain to tell them the why is in the core curriculum program.
Beautiful.
Yeah.
That's great. That's great. And if that totally works for you, then that's what I want you to do.
And the what?
Yeah, the what.
The what and the why, yeah.
Both are,
Yeah.
but more why.
The why needs to be used as a teaser more than like a justification, because people are just as skeptical. You know, you could say exactly why to someone, and they still wouldn't have that reality,
That's a great point.
right?
Yep.
So like, show them the sit test. Why does this work? I mean, if they have the results, if you get them, up,
Yeah.
and they see that it works,
Right.
and you get the results, they're going to want to know why.
Yeah.
Right. The why is in the manual. It's by the manual.
Yeah.
That's right.
So if we take this to its logical extension, it would mean we could eliminate the theory presentation entirely, right? I mean, the thing is that I don't think that people are willing to endure and go through ninja releases if we're teaching them the way we are now, until they understand why. Why would you do that to a body, right? I mean, you think it's enough for them to just see the results?
The theory needs to be there, it's just that,
It's like, it could be so much simpler.
Yeah.
Make the theory simple. As a doctor, as a practitioner, then they should go get the background information, why the theory is what it is. But to present the theory very simply, when I was thinking about this, there's 2 things that come to my mind all the time. Bones move in a direction, blah, 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 and the spinal cord gets stuck, preventing that from working right. Those are the 2 things that matter to me.
and flexion is bad and getting in relaxed extension is good.
Cool.
And when-
Let's fill this out. This is a perfect conversation. This is your manufacturing process through which the person moves. They come in, they're an input to your system. You create some sort of transformational atmosphere, transforms them from one state to another, and you're outputting something at the end of 2 days. Question is what? Everything you're talking about here is your transformational process, and that's what we're going to hand over to Linda in a minute. Just want to fill this out. Can we all agree the metrics are they purchase the CCP? They are willing to experiment immediately upon returning to their office. They commit to the journey, right? How many basics, how many advanced, buying this, studying it, grabbing a hold, really working with it, and doing their own unwinding, and that they call for coaching. Are these all measures and metrics that we're willing to say are the things that we have to look to now? To say whether or not this was a successful.
What is experiment immediately? What does that mean?
Yeah, experiment, try, do it.
Readiness.
Outside of the, with your people, use it, apply, use. Yeah, we haven't used the word experiment. When I wrote that, I was like, I'll probably get a question about that. But in a way, I mean, that's all we're doing. I mean, I'm experimenting all the time, right? Do this, what happened? Because evidence grabs me, it grabs you, right? So that's what works for me, is experimenting. But immediately, if we don't do that immediately, then, gee, You know, will I go to another basic, or will I call for coaching and go, I didn't use it. It's 6 months down the line, I have a feeling, a niggly feeling, whatever. So these are our metrics. What do you think people are coming in with? They come in with their own skill set, right? They come in with their own history, right? They come in with what else? Perspectives. What else? What?
Beliefs.
Pardon me?
Beliefs.
Beliefs, yeah, exactly. Okay?
They also come in with some hope or expectation of learning something that could
Okay. Hope.
be good.
Yeah, and curiosity. Okay,
Right.
good. Now, if we're going to follow what Dallas was saying, we can influence the input a little more. If we require people to at least watch 15 minutes of the video and to have read something small, whatever it is, we're going to look to you guys. What do you think should be? Because we can improve on a little bit of the input. Because here, it's kind of squirrely. Our suggestion at this point is that the instructor have a 5 or 10 minute conversation and ask the three questions to the person, just to communicate with them and connect with them before the seminar. That's one thing, and watch 15 minutes of the video. That's it. At least something. It'd be a boon if they agreed to buy the CCP first, right? But we're not likely to get that. So that's an input. What are the outputs we're looking for? I guess these metrics. Engage people, what's that?
Oh, I'm sorry.
I mean, no, these are metrics. Anything we're looking for in them that are outputs.
Competency.
Competency. Yeah, great. Good. Okay.
Willingness to go do it.
Yeah, exactly. So, and this process in here is all the things you're exposing them to funnel them and to make them into a different product. I was made into something different by being in the room with Jess, being exposed to certain things. So that's what curriculum is designed to do, is to move people from here to here. And this is the transformational process. I'll just, I mean, yeah, I don't know if I have to say it, but we were kind of defining this before, but understanding and describing core principles, right? Some of the things we want people to be able to do. You have to decide for yourself. Sleep, sit, stand, having mass through the practicum, understand, break down side. Certain things you want people to walk away with at the end. So again, you define for yourself, and that walks us through, that gets us up to the curriculum. Is this clear? Is this an interesting or helpful way to piece out the point of curriculum and the fact that there's a participant coming in with something, leave with something, and this is really up to us. And this is where we call it an experience. I mean, this is the quality of experience. It's a transformational process, moving from one state to another, and that's what they mean by transformational. So it's just a process orientation.
So you asked them if it was helpful. I didn't get a
I know.
read on it. Did they?
That's
Okay.
right.
Yep.
Oh,
Does it confuse matters more, or is it
No.
helpful?
my take on it is that you got the inputs,
Yep,
to transform them over there,
yep.
you're gonna do a 5 to 10 minute thing with them, asking them questions.
That would be adding to the input. So what you would have as part of the input
Yeah.
is you would come in, they would already have connection with you.
Oh,
You would have more clarity about their needs. You know about needs, right? So that's if you add anything. If they've read or the video or something like that. So we have the question of, before they get in the room, we have an opportunity to influence them, right? And then during, when we're with them, we can. And then after, what's their sense of the organizational support? What's your support? Will they reach for it?
so in doing the seminars I've done, I read all the pre-seminar surveys.
Yes,
It's always, almost all the time,
yeah,
better technique to help my patients better.
right,
If they're a first timer.
yeah,
Better at adjusting.
yeah,
But it's always the same thing.
Of course it
has
is.
to do with doing the thing.
exactly.
So how would you have a conversation about that other than say, well, see you at the class, because that's what you're going to get? I
Gotcha.
mean, what would you?
Yes. it's not for you. The call's not for you.
What do you mean?
It's for
No, I know
them.
it's for them.
It's
I'm
just
just
to, it's
saying.
just to create safety and sense of being valued. And uniqueness, that they'll get a unique response from you. That's what Jesse gave us, right? That's what moved us.
So I guess a good thing to say to them would be, that's great. I'm really going to teach you how to do this thing so you'll be proficient at it, make you technically competent,
Yes.
and you'll get results that speak for themselves, and you want to learn more.
That's so, no, that,
I'm
that's it right
serious.
there.
Tell them that.
That's it.
No, that's good. I
You
think should tell them that.
completely set them up. Like bump, set, friggin' spike.
Right.
Okay? That was, right? You know that comes from volleyball,
Yes.
right? All right, all right. But that was amazing. They're teed up. That is all that you can hope to do. Then you get a better product in the room to begin with.
Sure.
I want to ask you guys right now, brainstorm it. What 3 questions would you ask them or talk to them about? Because frankly, I think even if they say, I want better technique,
Why?
you might, yeah, you might get from them their horror story. Or you might get that thing we get in the advanced course from everybody, which is, shit, I thought I was doing the right thing all these years, but I'm hurting people. And I'm doing my best, and I want to help, but, and like, it's like an Alcoholics Anonymous, the advanced course introductions, for God's sake, right? Hi, my name is such and such, and I've been, screwing people up with everything I've known. And so, give me an answer. What 3 questions do you, or what do you think would be interesting to ask people beforehand? Let's just
Based
go.
on what they write down, correct?
No, it doesn't matter, no.
Are we talking, these are the phone questions before they've seen
Yes.
anything, before they
Yes.
know anything, they've just said,
Yes.
here's my credit card, I'm gonna come to your seminar.
Or they put their name on something as a possibly interested person. This is another way. If you're just, if you have a lead generator out there of some kind,
Right.
and they just put their name on a list, and you got 100 people, I don't know, you have somebody call, you call, and you have a minute. But let's just brainstorm questions, and then Linda's gonna come up and give you stuff, and we might, I don't know if we have practice time, but, maybe not. So then we'll get you on your way and find out what else you want, what other support. So questions, brainstorm. What do you think would be interesting to connect with people around?
What made you decide to sign up for the seminar, or ask questions, or make a call, or inquire about ABC?
Yep. What was your, yeah.
So why, yeah, same thing with why. Why did you inquire?
Why is this important for you at this time in your life? Because we only care about stuff that's important and relevant right now. We're all like dealing with so many tensions and like confusion and distraction. It's like, why could this be an important thing? Or why, at this time in your life, right? So, I'm sorry, I put words in your mouth.
No, I was just reaffirming that I would ask the same thing by just saying why. Why are you inquiring about the technique?
Okay, good,
That's
okay.
what I was trying to say.
Okay, good.
I think that what and the why in that aspect is the same thing.
Okay, I'm gonna, why could this be important? I'm just gonna add that. Give me some more questions.
And we should talk about what to say back to why, because I think we would probably all ask why first, and maybe what they would say back to that and how we handle that would probably be important.
Yeah, your only job is just to validate their experience so they feel safe and valued right away. Go ahead.
Why are you unsatisfied with your current skill set? Why are you interested in coming to the seminar and not out treating more people?
Okay. I don't know, you guys?
Could that be?
I think that's why is this important for you now? They're obviously not
It's the same
satisfied.
I think
Yeah.
it's
Well,
more,
Or maybe
I would
it's
say
just wanting
That's
to
making big
get
assumptions.
credits, seek credits, or
Yeah.
learn something different.
She says it's harsh.
Too
Yeah.
Yeah, that's my feeling too.
I mean, we're not.
It's making an assumption.
This is the baby step.
Let's put it in a positive language. How about if this worked the way you are imagining it could, what's possible for you and your business?
That's better.
Just to preface, what the marketing for this, is it the same basic marketing for people? Like, did we show a couple pre and post films, or pre and post pictures, I mean? Is that, and that's what we
These are
say?
people that are signing up for the seminar to instruct the calls.
She said there was
It's
like
a-
leads.
It's
people
a
were interested.
pre-seminar interview.
Okay.
Yeah, it's just, and you don't have to answer anything. All you do is say what Mark said. Which, Mark, say what you said again?
Excuse me?
Say what you said again, like as you're ending the conversation, you're saying, like, great, we're gonna get you skilled up, we're gonna da-da-da-da-da-da-da, what did you say? And you'll be flying, or,
And then you'll want to learn more.
yes, yes, period. So that's great, that's all you're doing is validating and teeing them up. What was another question that was in the room? I just want to make sure to get that down.
And if I can remember what Mark said, he just said, we're going to do that, see you at the seminar, right?
Yeah, yeah.
Whatever they say, if it's within.
Yeah. And if you guys like this idea, we'll type up some questions for you and get them out to you, because they become part, you can see how they become part of the curriculum, right? Because you're constantly, what do we say, what Marcia and Jim were talking about, you're constantly qualifying the person and getting them to think more clearly about the experience they're going into, so they know what to listen for and grab a hold of. So they're much more awake and alive. And if this gave you any other questions that you think would be useful, how about what would be your greatest wish for being in a course like this? Or what do you wish for? Would you be likely to ask a question like that?
How about describe? Use the word describe.
Describe what? Describe what?
Describe what you would like to experience at this seminar.
Good.
Or at this upcoming.
Good. Yeah.
Because if she talks about getting them on emotion, if they're describing something, there has to be an emotional connection to it.
Yes, there you go.
And I think some of the questions as somebody who might have to ask the question.
Yep.
I believe that Marcia and Jim said that we want to make sure that they have an emotional connection.
Thank you.
And that's going to drive them to drive in the car, fly to the place, to have a seat, pay the $290,000 billion, whatever it is.
Yep.
To have the experience that they described to you.
Yep.
They described that they wanted to come learn something that they had not been taught before. And you are, because I am not, but you, Dr. Gentile, Dr. E, and Dr. whoever, will be able to have and give you that experience that you said that you wanted by getting a technique that works, by not having any doubts when you walk out the door.
Thank you. That's amazing. That's huge. And basically, guys, you're starting to communicate all this right away. And you're giving trust, safety, and you're appealing to the emotions and letting them know that you care. Because that's the experience we had from Jess.
Yes.
So that's all we're doing, is carrying forth that piece of the DNA. Okay? So, without further ado, I would like to invite, where's Linda? Did you want to?
I'm right here.
Your wife? Julia, you want to?
No, she's.
Okay, okay. Great. All right, keys to the kingdom.
Thank you, Linnea.
Welcome.
I'm handing out some packs, and I'll tell you what's in them in a minute. Here, Mark. Laura. Matt. Roy. Dean. Dirk. Where did Dirk go? Jan, you got yours? Yes. All right.
Oh, it's on your table, sorry. I didn't know you needed it.
Okay, so let me just explain a few little things here. There's some notes there's some paper for taking notes on the left-hand side, and there's a post-survey that I'd like you to fill out at the end. There's a pre-seminar survey you don't have to worry about because we kind of did that verbally at the beginning there. On this side, I've tried to put in here a few things that I knew by former pre-instructor training surveys that people wanted to know about. Some of the instructors and some of their spouses and administrators have asked, well, what do we use for promo and how do we promote this and that? So these are just examples, like this is the postcard that we send out to mailing lists. And I've put an example of that so you can see what we're doing. And you can certainly use your own promotion to promote, or you can get these postcards from us. What we need the most is mailing lists, you know, good ones. So if you have, you know, a list of prospects in your area that you can get to us, we can promote. These are this is a sample email that Allison sends out, just a sample. It was for a Chicago seminar, but as you can see, it has the before and after pictures. And it has a little, you know, registration form that you can fill in. So it's just a sample. And this is what Australia now uses as their flyer, right? And this is how they're promoting their seminars. And they're getting a good amount of people at their seminars. What are they getting, between 15 to 25 people?
Yep,
Something like that.
yep. Referral is their main thing, I
Right.
think, yep. But they still advertise, you know, they're looking
They
to
do
get them.
advertise,
Yep.
but we're also finding, you know, the pictures and the website, we have about 12 avenues of promotion going on right now, and we're trying to work out more of them. But by far, the biggest one is you guys, you know, telling other people or demonstrating it to other people who then get interested. So word of mouth is the big one. It really is. So, okay, the next things in here is,
Linda, I don't know if you're going to cover it, but I just say for getting CE credits is a huge thing.
yeah, that's a big thing too.
And
Yeah.
I need some assistance on that, that's my thing, but work with me. I need your CVs to do that, and to get to the state, and any help that you have, any connections you have with your local associations will help. But that's important, and now that we have a lot of people teaching, I'm hoping we can get lots of CEs.
It's a draw for a lot of people, CE credits, so.
And you
Yeah,
know,
feel free to add anything, Ally.
They're very successful in Australia with that. Is that,
Yes.
you already said that?
Yes.
Okay, yeah.
But funnily enough, when you have people that come just for CE credits, it's kind of hard to convert them over
It's
to
true.
CCPs.
No, they were
So,
saying people get grabbed.
yeah, they do. They
Yeah.
get grabbed if the results are enough, just like we've all been going over, right? So you get them there any way you can.
Right.
There you go.
Okay, so a couple, I don't want to spend a lot of time with this because I think it's more important that if we have time for anything, that we spend it with you drilling whatever you want to practice or practicing whatever you want to practice, right? But I do want to go over a few things. In the surveys, a lot of you were questioning who does what and what do I have to do to be an instructor and what are the prerequisites and what and some of you didn't even really know exactly the certification requirements and things like that. So I just put together a few little things here, like this is basically the duties of a presenting instructor and the duties of an assistant instructor and the duties of an administrator. So it basically goes over, it puts a system in place. We talked about systems, right? So I'm trying to give you some systems here of this is what you know, Jan would do, this is what Steve would do, this is what Laura would do, this is what Mark would do, etc.
I'm sorry, where is that?
I don't have that.
It's in your instructor manual. If it's not in there, different, it should be on your left side if you have it. If you don't have it in your pack, it's because it's in the instructor manuals, which I haven't passed out yet,
Ah,
okay?
fair enough, thank you.
I put it in packs for those who aren't getting manuals because they're not instructing yet, all right? And there's things like, Allison has had lots of experience packing up seminars and what you need, and then getting there and realizing, oh, we forgot blah, right? And then having to run to the store and go get it. So Allison, originally, and then me added to it, a packing list. So if you're packing up for a seminar You have a little packing list here, it tells you exactly what you have to bring, that we know you're gonna need. And Dallas, you know, if you're helping Guy, this is your list, okay? You can add to it anything you find, you know, like, we're always adding to it, always. Like, we're gonna add now the sticky tapes and pads and paper and things like that that aren't on here. All right? This one is a basic seminar administration checklist. And this is basically a checklist that you use, you know, to, like day 1, when you get there, what do you do? Day 2, what do you do? Day 3, what do you do? If we end up having more than one. But what you do each day in sequence and what you have to set up. Again, it's just a little system to help you, right? So that's what's in there.
And you
then-
got through all of this alone?
Yes.
Oh my God. Better you than me.
Well, Allison too, I mean, she's,
Yeah.
you know.
That's great.
Another thing that I wanted to give you, and I'm going to save the top thing for last, which is many tools have been given to you today to use for eliciting answers to questions and bringing out barriers and objections and considerations and whatever. There's a lot of tools we have. We can't possibly even communicate them all in a 3-hour, 4-hour thing. But a lot of you have mentioned wanting to improve your presentation skills, wanting to improve your communication skills, various different things, and you filled out the seminar. We have tons of these tools, tons of them. And I would be happy, after this is over, to sit down and work out, you know, she talked about make a program for you, like develop your own plan of what you need and want and when you're going to teach and what you need to be trained on, et cetera, et cetera. And I'd be happy to go over, even sit down with you individually and help you do that when this is over, or give you some more ideas of tools that I know exist to improve, like, communication, to improve, even to be able to speak in front of a group, or to do voice drills that get you able to project to a whole room. I mean, what if you had a 100 person seminar? Could you handle that one? You'd get a microphone, right? So, whatever. But we've got just lots of drills and different things you can do, including various little communication things that will help. So if you're interested in any of that and you want to talk to me about it afterwards, I can go over various options for you, okay? One tool that Jesse uses a lot, and I know Mark uses this too, is when you're teaching anybody anything, or when you're trying to learn anything, there's 3 things that we know are barriers to learning, barriers to studying, that are very, very, very obvious. And I know Jesse constantly uses this when he does seminars. I know Mark does too. And I happen to find online a free little download on it from what's called Applied Scholastics. And it does a very cute little job in picture form of explaining these 3 barriers. And it's kind of like, so I included it. I downloaded it and printed it all for you. You can read it at your leisure and use it if you choose, or throw it away if you don't like it. It's up to you, all right? But I can tell it's very useful, because have you ever, I've sat there, you know, and watched, have you ever seen like somebody try to learn an AMR, right? And the teacher's trying to say, no, step back, step back, step back. You know, you gotta lean, you gotta put back. You're not gonna get any weight in here. And they can't do it because they've skipped a gradient. They can't even think about their feet because they're worried about where their hand goes on the head, because they happen to be in the bathroom or something when Jesse explained where to put the hand. And so they can't figure out where to put the hand on the head. And you're trying to tell them, no, lean your way back on your feet and walk around the table, and their attention's on something else.
Could I interject one little thing there? I don't know if you guys all know, but Dirk made the suggestion that we use another dot on the side where you put your hand to push. So I've bought blue dots and we've started using them and seeing how it's going, and I think it's going pretty well. So you have
Right.
3 dots, one on the push and the other on the
Right.
connect the dots.
That's called a skipped gradient. That means they didn't learn some part of the thing earlier, and you're trying to teach them a later thing, and they don't get it, because their attention is so much on what they missed earlier, and that they can't get the later thing.